To be truly effective, vaccines, treatments, and diagnostics must be affordable and accessible to all.
Equitable and universal access to vaccination, treatment, and diagnostics.
We must all work together on improving diagnostics, accelerating therapies, and ultimately developing a vaccine.
Everyone should have access to COVID-19 testing, treatment, and vaccines.
But the task will only be completed when vaccines, tests, and treatments are available and affordable to every child, women and men who needs them.
To support vaccines, therapeutics, diagnostics development, preparedness efforts, and humanitarian assistance.
On how to make vaccines, treatments, and diagnostics accessible to everyone.
In addition to investing into diagnostics, therapies, and vaccines.
So the race for a vaccine, for better treatments, for quick and reliable tests.
Impfstoffe, Tests und Medikamente müssen für alle Menschen auf der Welt verfügbar, bezahlbar und zugänglich sein.
COVID-19 research and development work on vaccines, diagnostics, therapeutics and respiratory medicine.
To provide universal access for the anti-COVID drugs, tests and vaccine.
To make sure that everyone has access to treatments, to vaccines, to a strong health system.
To fight COVID-19. Vaccines, treatments and diagnosis will be the most effective way to do it.
Des moyens de diagnostic, de traitement et des vaccins.
Whether I should be able to access in vitro diagnostics like tests and therapeutics and vaccine.
For better diagnostic and therapeutic medical supplies. We must also ensure that there is access to better treatment and care in the global quest for a vaccine.
In ensuring development, production, and equitable delivery of COVID-19 diagnostics, therapeutics, and vaccines.
For vaccines, diagnostics, and health systems.
Has access to COVID-19 tests, treatments, and therapies.
COVID-19 tests, treatments, and vaccines, and strengthen our healthcare systems.
That the solutions for this pandemic are going to come from science, whether they're new diagnostics, new vaccines, or new therapeutics. So we're working with a number of partner agencies to try to develop a new vaccine for COVID-19.
As it ensures impartial access to diagnostics, treatment, and later on, vaccine against the disease.
Is needed to ensure access to COVID-19 tests, treatments, and vaccines for all.
To ensure that new COVID-19 diagnostics, therapeutics, and people's vaccine are safe, effective, and affordable.
For treatments, vaccines, and tests.
On equitable access to diagnostics, treatments, and vaccines.
We need new diagnostics, vaccines, treatments, and an equal distribution to all.
We need to make vaccines, treatment, and diagnostics accessible to everyone.
We can develop an effective vaccine, effective treatments, testing systems that work, diagnostics and therapeutics.
COVID-19 diagnostics, therapeutics and vaccines.
Of effective diagnostics, safe treatment and vaccines.
Diagnosis, treatment and vaccine development.
But you don't have a choice. People act like you have a choice. For the world at large, normalcy only returns when we've largely vaccinated the entire global population.
I mean, and we're taking things that are, genetically modified organisms, and we're injecting them in little kids' arms. We just shoot them right into the veins. We just shoot them right into the vein.
Reducing the population growth. Reducing the population growth.
When we've largely vaccinated the entire global population.